living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Understanding Social Security is an important part of retirement planning, but Social Security is more than just a retirement program. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Jacob Churchill, and today we're talking about Social Security, the latest news, the 2023 cost of living adjustment, and other important Social Security information. Stay with us and we'll be right back. Welcome back to Healthy Living for Life. Joining us today is David Bayer, a public affairs specialist from the Social Security Administration. Thanks so much for joining us today, David.
Good morning. Thanks for having me on.
Absolutely. So as Americans, we all have Social Security numbers. For those of us who work and pay into Social Security, we see the holding on our paycheck stubs. But just to make sure everyone understands, what exactly is Social Security?
Social Security provides financial protection for our nation's people, supporting Americans throughout all of life's journeys. We administer retirement, disability, survivor, and family benefits, and enroll individuals in Medicare. Social Security, retirement, and disability is a wage replacement insurance program. It was created to promote the economic security of the nation's people. It is designed to pay retired and disabled workers a continuing income.
Okay, and for those of us who are working, Social Security is a tax that comes out of our paycheck. How much is that tax right now?
The current amount of Social Security tax, also known as FICA, which stands for Federal Insurance Contributions Act, is 6.2% on earnings up to $160,200 and 1.45% on all earnings for Medicare tax. And that is for both the employee and the employer. Now, if an individual is self-employed, they pay both portions of that for a total tax of 15.3%.
Okay. And I understand that to qualify for Social Security retirement benefits, you need 40 Social Security credits. Can you explain how that process works for us?
Yeah, so credits are based on your total wages and self-employment income for the year. Now, you might work all year to earn your 4 credits, or you might earn enough for all 4 in much less time. Now, the average amount of earnings it takes to earn a credit may change each year. Now, in 2023, though, you earn 1 Social Security and Medicare credit for every $1,640 in covered earnings each year. You must earn $6,560 in 2023 to get the maximum 4 credits for the year.
Okay. And we're earning credits for our own benefits, but we're also helping pay Social Security for others, right? How does that work?
Well, the money you pay in taxes isn't held in a personal account for you. Okay, it's not for you to use when you get benefits. We use your taxes to pay people who are getting benefits right now. Any unused money goes into the Social Security trust funds. It's not a personal account with your name on it. Now, think about FICA like this. So right now, if you're working and paying FICA taxes, you are contributing to the Social Security and Medicare program trust funds. You're helping your parents and your grandparents have a secure retirement. Now, as your career grows and you contribute more into Social Security, you're helping your family secure today and tomorrow. And when you retire, your children, your grandchildren, they are helping you.
Okay. And how is Social Security funded? Is it completely reliant on those tax withholdings?
Now, Social Security is mostly financed through the dedicated payroll tax that we talked about earlier. But additional income does come from the taxation of benefits and interest earned. So total income, including interest, to the combined old age survivors insurance and the disability insurance trust funds amounted to $1.22 trillion in 2022. So approximately $1.1 trillion was from the net payroll tax contributions, about $49 million from the taxation of benefits, and $66 billion in interest on those funds in the trust fund.
Okay. And how does Social Security come into play if someone is unable to work due to a severe disability?
Social Security administers two programs that can assist those individuals. So the Social Security Disability Insurance and another program called Supplemental Security Income. They both provide assistance to people who meet our requirements for disability. So if you can't work because of a physical or mental condition that has lasted or is expected to last 1 year or result in your death, you may be eligible for Social Security disability benefits.
Okay. And what happens when a married couple is receiving Social Security benefits and one of them passes away? What happens to their Social Security benefits?
The loss of a family wage earner can be devastating, both emotionally and financially. Social Security helps by providing income for the families of workers who die. Now, if you're getting benefits as a spouse based on your spouse's work, we'll change your payment to survivor benefits when you report the death to us. So it's just an automatic thing if you're already receiving a spousal benefit. Now, if you're not getting benefits based on your spouse's work, say if you're only receiving benefits off of your own record, and your spouse passes away, you want to call or visit us. We will check to see if you can get more money as a widow or a widower. If so, you'll get a combination of the benefits that equals the higher amount. So essentially you'll get your portion and an increased portion if you're eligible off of the deceased spouse's record. In order to do that, though, you must complete an application to switch over to the survivor benefits if you're not already entitled as a spouse on that record.
All right, that's all great information, David. Unfortunately, we're coming up on a break here, but coming up next, applying for Social Security and disability benefits isn't as hard when you know what the process looks like. Don't go away, and we'll be right back. Welcome back. Still with us is David Bayer from the Social Security Administration. Thanks again for sticking around, David.
No problem.
Now, if someone is thinking about retiring, when should the person apply for Social Security benefits, and what does that process look like for them?
Well, you can apply for retirement benefits up to 4 months before you want to start receiving your benefits. You can file online through your My Social Security account, or you can set up a phone or in-person appointment by calling our national toll-free line. That number is 1-800-772-1213, or you can visit your local Social Security office and they can assist you with setting up that appointment.
Okay, and whether a person chooses to go online, call someone, or go into the office in person, what kinds of documents or information do they need to have on hand to apply?
Now, when you apply for benefits, there are some documents and information that we will ask you to provide. The documents you need to kind of depend on what type of benefits you're going to be filing for. Generically, though, for just about every application, information that we're going to need is your date and place of birth, your Social Security number, the name, Social Security number, and date of birth or age, if you don't remember the date of birth, of the current spouse and any former spouse. You should also know the dates and places of marriage, and if you have any ex-spouses, the dates of divorce, or if you are a widower, the date of death for your spouse, the names and ages of any unmarried children under the age of 18, or up until age 19 if they're still in a secondary school like high school, and Or also, if you have a child who is disabled prior to age 22, you would want to bring that information in as well. We're also going to need your banking information. So we're going to need your routing or transit number, the account number, the month you want your benefits to begin, and if you're within 3 months of age 65, whether or not you want to enroll in the medical insurance. We're also going to need the names and address of your employers for this year and last year, and the amount of money earned last year and this year. And if you were filing for benefits towards the end of the year, from September through December, we're also going to ask you to give us an estimate for next year's earnings. Now, even if you don't have all the information that we need, you should still submit an application of any documents or information you have. You can provide the information later, and we may even be able to help you assist you in getting some of that information that you might be missing.
Okay. And what about the process for applying for Social Security disability? Does that look similar to the standard Social Security?
Yes, it's very similar, but there are some additional things and requirements and information that we will need for you when you file for disability. We're going to need the name, address, and phone number of somebody who we can talk to that knows about your medical conditions. We're going to need detailed information about your medical illnesses, injuries, or conditions. Names, addresses, phone numbers, patient ID numbers, and dates of treatment for any, the doctors, hospital, or clinics that you've been seen at. We're also going to want you to provide a list of the names of medicines that you are taking and who prescribed them, and the names and dates of medical tests you have had and who sent you for them. Now, this is all in addition to the requirement that I answered in the previous question for the just general retirement claims. That's additional information we ask for disability.
Gotcha. And what about supplemental security income? What is that, and how does someone apply?
Well, the supplemental security income, it provides monthly payments to adults and children with a disability or blindness who have income and resources below specific financial limits. So SSI payments are also made to people age 65 or older without disabilities who meet the financial qualifications. Now, the easiest way to begin is to request an appointment to file for benefits. And you can request an appointment for yourself, or if you're assisting someone, you can also, reach out and set up an appointment for somebody who might have need some assistance in filing for the SSI. When you reach out and talk to us, our representatives can answer any questions, explain needed documents, and guide you through the application for SSI.
Okay, great. And could you talk to us for a moment about the My Social Security account? What is that, and how does someone sign up for it?
Yeah, the My Social Security account is SSA's free and secure online benefits portal. To get it started, what you want to do is visit www.ssa.gov/my account. Once you get there, what you can do is select the Create an Account button. Now, it'll route you to a place to create a credential with one of our 2 credential partners. We have 2 of them, login.gov or id.me. Now, if you already have a login.gov or id.me account, you can select the appropriate button to access your personal My Social Security account.
Okay, and what are some of the benefits of creating a My Social Security account?
Well, the My Social Security account provides personal tools for everyone, whether you're receiving benefits or not. You can use your account to request a replacement Social Security card if you're not on benefits. If you filed, you can check the status of an application. If you filed online to the My Social Security account, you can log on at any time and see what that status is. You can estimate future benefits. So if you're not on benefits yet and you're trying to plan for your retirement, there's a lot of information on there that will assist you in doing that. And once you're on benefits, you can manage those benefits. You could, update address, phone numbers. If you change banks, you can do that all through the My Social Security account.
Wow, it sounds like quite a resource. Well, thanks for all that.
Yeah, it is really nice.
Thanks for all that information, David. Unfortunately, we're up against another break, but when we come back, we're looking at changes to come in the future of Social Security. Please stick with us. Welcome back. Still with us is David Bayer from the Social Security Administration. Thanks again for sticking around with us, David. We appreciate your time this morning. Let's talk about some of the changes in the Social Security program. Can you talk a little bit about the cost of living adjustment this year, or the COLA?
Yeah. So based on the increase in the Consumer Price Index, CPI-W is the code for it, from the third quarter of 2021 through the third quarter of 2022, Social Security and supplemental security income beneficiaries received an 8.7% COLA for 2023.
Okay. And in 2022, there was a hike in Medicare Part B premiums. Is that the case this year as well?
Medicare Part B, the medical insurance, premiums vary based on a person's income and can change each year. The law requires an adjustment to your monthly Medicare Part B premiums. Now, each year, the Medicare Part B premiums, deductibles, and coinsurance rates are determined according to the Social Security Act. The standard monthly premium for Medicare Part B enrollees is $164.90 for 2023. Now that is a decrease of $5.20 from $170.10 in 2022. Now also the annual deductible for all Medicare Part B premium beneficiaries is $226 in 2023, which is a decrease of $7 from the annual deductible of $233 in 2022.
Okay. And are there any other changes to the program in 2023 or on the horizon in the next few years?
There were some changes to the Medicare enrollment periods starting January 1st of 2023. So your Medicare Part B coverage start dates has changed. It now is the first day of the month after you sign up, if you sign up during the last 3 months of your initial enrollment period. So that's if you wait till after 65 to enroll in your initial enrollment period. Before this change, if you signed up during the last 3 months of your initial enrollment period, your Medicare Part B coverage started 2 or 3 months later after you enrolled. Now it's the month after the month you enroll. Also, there were some changes to the what we call general enrollment period. So if you didn't sign up for Medicare Part B during your initial enrollment period and you don't qualify for one of the special enrollment periods, you have another chance each year to enroll during the general enrollment period. The new changes are that if you enroll in the general enrollment period, which is January 1st through March 31st of every year, your coverage starts the first day of the month after you sign up. So if you come in and talk to us in February and say, I need to get on Medicare, your Medicare would start March 1st.
Okay. Now, there are always concerns and conversations about Social Security running out, the program being cut, or Social Security just going away. Is there any truth to those possibilities?
The future income and cost of the old age and survivors insurance and disability insurance, OASI and DI trust funds, will actually depend on many factors. The combined asset reserves of the OASI and DI trust funds are projected to become depleted in 2034, with 80% of benefits payable at that time. Now, the OASI trust fund in itself is projected to become depleted in 2033, with 77% of benefits payable at that time. The Disability Insurance Trust Fund asset reserves, they're not actually projected to become depleted during the 75-year projection period, and that's the period that they're looking at when they're doing these actuarial reports. The Social Security trustees, in their recent report to Congress, continue to recommend that Congress address the projected trust fund shortfalls in a timely fashion to phase in any necessary changes gradually.
Now, let's talk about those folks who go back to work after retiring. Should people stop Social Security to go back to work?
Well, you can actually draw Social Security benefits and work at the same time. However, if you are younger than full retirement age and make more than the yearly earnings limit, which is $21,240 for 2023, we will reduce your benefit.
And what about those people who never stopped working but are of the full retirement age for Social Security?
Well, starting with the month you reach full retirement age, we will not reduce your benefits no matter how much you earn. So if you're full retirement age, you can work and earn as much as you want and it won't affect your Social Security benefits.
Okay, and I'm aware that some offices closed during the COVID-19 pandemic and some employees are working from home. What are the best ways for people to get information to help their Social Security benefits?
Well, we have resumed all in-person services at the local Social Security offices, but most Social Security services are available online with the My Social Security account or by telephone. Most Social Security services actually do not require a visit to an office, but we are open for all in-person services at our local Social Security offices.
That's fantastic news. Now, we are unfortunately about out of time, but is there anything else that you wanted us to know before we leave for the day?
I just really like to reiterate how important that My Social Security account is. I really encourage everyone to try to set that account up because planning for your retirement is really important to your financial security. Or if something were to happen, you were in an accident or became disabled, you want to be able to plan for that and understand what is available to you. So I do highly encourage everybody to visit that www.ssa.gov/my-account and set up that My Social Security account. It's pretty easy. You just got to be over the age of 18. And like I said, use one of those credentials to set up that account, and it'll really help you plan for your future.
Fantastic. Thank you so much for all that wonderful information, David. Unfortunately, we are out of time for today. And thank you for watching. And we hope you'll come back next week and join us. But until then, please stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.